Hello and welcome to Headline News in Neuroendocrine Tumors, or NETs. I'm Steve Highsmith. All through 2011, Oncology.TV has brought you up-to-date coverage of the latest abstracts presented at global Neuroendocrine Tumor Society meetings. Today, we will highlight several abstracts presented at the ESMO European Multidisciplinary Cancer Congress held in Stockholm, Sweden from the 23rd to 27th of September 2011. We had the pleasure of speaking with Dr. James Yao, who reported results from the Phase 3 RADIANT-3 study, specifically the effect of Everolimus treatment on markers of angiogenesis in patients with advanced pancreatic neuroendocrine tumors. Dr. Yao, thanks for joining us for talking about data from this important trial. First off, what did you feel were some of the highlights in NET reported at ESMO 2011?
Hi, Steve. Thanks for having me on the interview here. I think this year for ESMO, we saw some updates and additional analysis for some of the major Phase 3 studies that was completed in the last couple of years. For Everolimus, there was data from RADIANT-2 and RADIANT-3 study. The updated safety data showed no additional new safety signals, and essentially the efficacy data look fairly similar to what was presented in the last couple of years. For the sunitinib study, additional update of survival was also provided. However, with additional longer follow-up, there's no longer any significant differences in overall survival between the two arms in the sunitinib study.
In your ESMO abstract, you reported on the effect of everolimus on angiogenic biomarkers in patients with pancreatic neuroendocrine tumors from the Phase 3 RADIANT-3 trial. Can you tell our audience about the primary results from the RADIANT-3 trial?
Well, the RADIANT-3 study is the double-blind placebo-controlled study that compared everolimus to placebo plus best supportive care in patients with pancreatic neuroendocrine tumor who progressed within the past 12 months. The primary study results showed a significant benefit for those treated, with progression-free survival being 11 months for those receiving everolimus versus 4.6 months receiving placebo. This means that there was a hazard ratio of 0.35 or 65% reduction in the risk of disease progression. The study here that we presented looks at the effect of everolimus on angiogenic biomarkers. This is exploratory analysis that will help us better understand how the drug works, and in the future whether or not they can be prognostic or predictive biomarkers in helping us selecting patients for treatment. In the data here that we shared at ESMO this year, we checked a number of biomarkers, including VEGF, basic FGF, soluble VEGF receptor 2, PLGF as well. And what we saw is that everolimus was associated with a significant reduction in soluble VEGF receptor 2, and was also associated with a significant reduction in PLGF. Although the reduction in PLGF is statistically significant, the absolute change was fairly small. However, this was a pretty consistent result. For basic FGF, we saw a reduction at cycle 2, day 1. However, this did not persist. And over the next couple of cycles, the curves come back together, suggesting that the reduction in basic FGF may be transient effect of everolimus. In the future, I think we'll be doing additional analysis to see whether the baseline or treatment-induced change in these biomarkers would have a significant prognostic or predictive effect in terms of patient outcome treated.
Dr. Yao, please describe the rationale for evaluating changes in angiogenic biomarkers in these patients.
I think these tumors are very vascular tumors, and certainly the angiogenesis is thought to be an important pathway of supporting tumor growth. There has been prior data from animal models that suggest everolimus, an mTOR inhibitor, exert part of its anti-tumor activity through its effect on angiogenesis. And so we want to do several things. One is we wanted to understand how the drug affect the markers of angiogenesis. And we also know that if the drug affects angiogenesis potentially in a very different way than other agents such as VEGF inhibitors. So changes in these biomarkers are kind of exploratory analysis for us to understand how that works. I think we are also going to obviously want to know how blood level from both the patient treated with Everolimus as well those placebo patients are whether they are going to be helping us to understand which patient has a better or worse prognosis, so that we can better able to determine which patient needs treatment.
So, Dr. Yao, what is the clinical significance of these results for patients with pNET or other solid tumors?
There's really no clinical significance yet. I think the next step, which we hope to get done in the coming months and potentially present at a later meeting such as ASCO, would be then to really correlate the blood level both at baseline and treatment-induced change with outcome. I think that will be the step at which we can translate this into a clinically relevant finding that may help us determining treatment options.
Finally, would you like to say a few words to summarize what we've discussed today?
Steve, this has been a fairly exciting couple of years for the field of neuroendocrine tumors. We saw the completion of 3 major phase 3 studies, and I think the field is advancing. We are going to learn more about the disease from these studies that are completed. For example, I think we're going to learn more about how the patient performed both on the treated arm and placebo arm to understand, in fact, who needs treatment and what are the prognostic and predictive biomarkers. And I think there's going to help us move forward in terms of advances in the field. I think in the next few years we'll also see completion of a few other large randomized studies. This includes the pNET study that compares lanreotide to placebo and the phase 3 study that compares bevacizumab to interferon. And hopefully these studies will also lead to further advances.
Dr. Yao, thank you for joining us today.
Steve, thanks again for having me here on the show to discuss the advances in the field of neuroendocrine tumors, and look forward to sharing more exciting results in the future.
That's Dr. James Yao discussing the results from the Phase 3 Radiant-3 study. We thank all of the experts who participated in this edition of Headline News and Nets. I'm Steve Highsmith. Be sure to watch coverage on the latest news and nets right here on Onciview.TV.